Pleased to say we're joined now by Nadhim Zahawi, the Minister responsible for the vaccine rollout. Mr Zahawi, good to have you on the programme this morning. And by goodness, there is a huge amount of pressure on your shoulders, isn't there? In essence, it looks like we need to be moving from 300,000 vaccinations a week to 300,000 vaccinations a day. Now, even by Hercules' famously exacting standards, that is a Herculean task in front of you.
It is, and it is a big task. The NHS, both in England, Scotland, Wales and Northern Ireland, have got a very clear delivery plan. And the plan is, as we launched initially with Pfizer, a novel vaccine in hospital hubs, then into what are called primary care networks, so a network of 5 or 6 GPs coming together, one leads, and then they begin vaccinations. That has grown massively. That's the 730, the bulk of that delivery network now. We then go to national vaccination hubs that the NHS have got planned, and of course the community pharmacies and the independent pharmacy sector as well. So it's a massive effort by NHS England in England, NHS Scotland, Wales and Northern Ireland, and they have a very clear plan. They've delivered 1.3 million over 1.3 million doses already. A quarter of those, so 1 in 4 80-year-olds have already had the first jab, the vaccination, and in a couple of weeks' time, those 25% of 80-year-olds will be protected, and of course will then get their second jab as well. So it is a Herculean effort. I'm pleased to see Keir Starmer saying that we need to come together. I hope we get the support of all political parties, all members of Parliament, and the whole country, as we're seeing volunteers coming through the National Volunteering Service. And thank you to the Sun newspaper for their campaign, and of course to St John's Ambulance, who are leading on the volunteering, and NHS professionals as well.
Let's just talk, though, about the achievability of that which the government has set out. We heard from the Prime Minister the ambition is, of course, to get nigh on 14 million people vaccinated by the middle of next month. By the end of this month, we're looking at around about 2 million vaccinations every week. We heard Chris Whitty say that this was realistic but not easy. Matt Hancock suggesting this is a best-case scenario. I mean, how would you categorise it? Doable at a stretch?
It's a big target, and I think the Prime Minister's right to set us challenging targets. We need to get on with this and do it as quickly but as safely as possible, which is why, again, I commend the NHS for the plan that they've put in place. The military are embedded in the team, and I pay great tribute to Brigadier Phil Prosser of 101 Logistics Brigade, who absolutely is there focused on this delivery programme. So it is a coming together of the nation to deliver this. It is a stretching target, no doubt, very stretching target. But I'm confident that with this plan that the NHS have put together, we will deliver this.
Sure, I hate to keep hammering the point, but there have been occasions throughout this pandemic where the government has perhaps overpromised and under-delivered. Taking the 14 million by the middle of next month and 2 million a week. Look, if we are getting 2 million vaccinations a week by the end of this month, let's just gently suggest that that would be a total of 8 million, charitably, by the end of the month. That means 6 million doses in 2 weeks. Now, it's early in the morning. My mathematical skills are pretty rudimentary, but 6 million divided by 2 weeks is 3 million vaccinations a week. 2 million a week in and of itself. If we hit that, we're not going to hit the target next month. Isn't that analysis accurate?
Well, I'm confident that as we begin to deploy and get more sites operational, I talked about the hospitals, the GPs, of course, the community pharmacies and the national vaccination centres. So we will be at over 1,000 sites vaccinating. I'm confident you will see, certainly from the 4th of January to the 11th of January, a real step up. So we've done over 1.3 million since the 8th of December. You're going to see a massive acceleration of that.
But we need to do more than 2 million doses a week, don't we, to get to that 14 million target by the middle of next month?
Yeah, no, absolutely. And you're going to see that increase. The NHS have got a very clear plan. We've got a fantastic team working 7 days a week, all hours, to deliver this. And as I said, I think it's a stretching target. No doubt it is a stretching target. But I think it's one that we should absolutely look to deliver, because if we do deliver that and deliver those 1 to 4 categories that the Joint Committee on Vaccination and Immunisation have identified are the most vulnerable, then you will hopefully see that a couple of weeks later reflected in the coming down of the hospitalisation rates, and ultimately mortality begins to also be impacted. So we see less people dying from this horrible virus.
Just in terms of the problems that there may well be at the moment, one that has been identified and referenced by the Prime Minister yesterday was the batch testing of the virus. Once the fit and fill section of the production process has taken place, it is taking as long as perhaps 20 days for batches to receive that approval. How can we trim that down but remain safe?
So there are a couple of things. So first of all, when the bulk vaccine goes to the fill and finish operation, then it does need to effectively go through a number of tests, including something called the sterility test. Now, different batches are in different timelines for that. The MHRA, and I again pay tribute to June Rain and her team, are doing everything in their capability to do it properly, without cutting corners, and safely, to test then every batch. Because the worst thing we can do is, in a national vaccination program that is the biggest in this nation's history, is to get this wrong and to have a vaccine that is not effective being used. So it is important, but we do look at each and every step to make sure that it is done as efficiently as possible. And as we get more volume coming through from the manufacturers, I'm confident that we've got enough visibility to be able to really go after that Prime Minister's target of mid-February, being able to deliver north of 14 million doses and offer those to those first 1 to 4 categories.
Just in terms of the assets that we're using to get the vaccine into people's arms, there are some within the pharmacy industry, I should say, rather than the pharmaceutical industry, those working in pharmacies. There appear to be thousands of people there who, of course, are experienced in the administration of vaccines because of the influenza vaccine. Why are they not already being stood up to being used? It does seem like there is a resource lying there waiting to be taken up with the government.
There is a very important resource, and we are taking it up, and we're working with the community pharmacy sector, a very important sector, and of course the independents, as you mentioned as well. What we did was stand up the hospitals first, because as Chris Whitty has quite rightly identified, when you have a novel vaccine, you want to make sure that as you increase the numbers of people being vaccinated, you do it in a careful way where you can observe people. The regulator has what is called a yellow card system, so that we see how people are reacting to the vaccine in a very safe way. And then we go into GPs. GPs are the most effective way of getting into, say, for example, the care homes. It's very important in that first category, in fact, is to get into care home residents, and that's the best way to get into care homes. So we went with the GPs, which is the NHS plan I was talking about, then into national vaccination centres, which you will see imminently, and then into the community pharmacies and the independent sector. So every sector will play a part in this. And I commend both the independent pharmacies and the community pharmacies for stepping up and coming forward. And as I said, we're working with them to operationalise them, and you'll see that coming through in the NHS plan.
A number of people will have been concerned to hear the Chief Medical Officer suggesting yesterday that, Christmas time this year, there could still be some restrictions in place, face masks, social distancing. What is your view on all of that? What is the likelihood that we will still have some restrictions? I mean, the vaccine, we know, is not the be-all and end-all. It is not the only response. We will all still have to play our part, won't we?
Of course, and my focus is very much on vaccine deployment. It is the largest vaccination program in the history of this country. I think once we begin to make a difference to those most vulnerable people, so categories 1 to 4 by mid-February, we go then all through the rest of the categories down to category 9.
Sure, but do you still see restrictions being in place at Christmas, or the potential for restrictions being in place at Christmas, as Chris Whitty said yesterday?
Well, I think, as Chris Whitty has also said, is this will be a political decision. And when we get to that point of inflection between where community transmission is really impacted by the vaccination program, and of course by continuing to ramp up the testing infrastructure in the United Kingdom, then the decision for government, for us, is to say, well, when is it right to begin to lift some of the non-pharmaceutical interventions that we're having to make, like the current lockdown that we are in? There will come a moment when we see where we can basically manage this virus and be able to bring it back under control. And that is a decision for the government.
Nadhim Zahawi, good to see you this morning. A busy man indeed. Thanks for joining us.
Thank you.